Hi, welcome back to the channel. In the last video, I promised you that I was going to give you some specifics about some of the medications that I've been taking. And I thought I'd start at the end with the medication that was administered in the nuclear medicine department. It was administered by a nuclear medicine doctor and specifically by a nurse or attendant or uh, nurse practitioner who was trained in nuclear medicine. And it was administered with an intravenous injection. It was considered semi-dangerous. As a matter of fact, when they administered it to me, they had another attendant walking around me with a Geiger counter, and so I thought, well, look, how about that? I'm radioactive. Anyhow, let me see what I can read to you here. This medication should be used by health professionals who are appropriately trained in use of radiopharmaceuticals. Bone marrow suppression that may be severe, life-threatening, or that may lead to death. Tell your healthcare provider right away if you get any of the following signs and symptoms at any time during treatment. So if I felt tiredness, weakness, and pale skin, shortness of breath, bleeding or bruising more easily than normal, or difficulty to stop bleeding, frequent infections with signs such as fever, chills, sore throat, or mouth ulcers. Kidney impairment can occur in patients treated with this medication. Tell your physician about any kidney condition prior to receiving Pluvicto. That kidney condition was probably ruled out with the blood work that they had me go through before they started administering the medication. Let me see, I experienced tiredness. I don't think I experienced weakness. I don't think I experienced shortness of breath until much later in the administration of the medication. And I've let them know they didn't seem to think that that was particularly important. No bleeding or bruising more easily than normal, and no frequent infections. What is the medication used for? To treat adults with a certain type of advanced prostate cancer. And I'd been told all along that this was very advanced. I may do another video in the future letting you know what stage of cancer I was at when they first diagnosed it, especially on the Gleason scale, etc., etc. If you don't know what the Gleason scale is, I will try to find a more professional definition of what it is. So it's to treat adults with a certain type of advanced prostate cancer called prostate-specific membrane and antigen-positive metastatic castration-resistant prostate cancer. Okay, let me see if I can translate some of this for you. Start from castration-resistant. I'd mentioned in a previous video that prostate cancer worked with the level of testosterone in a man's body. So the higher the level of testosterone, the more that the prostate cancer fed on your body, and the stronger it became. The more it liked it, and the more it spread in your body. Let's see what else. Metastatic meant that it had spread from the prostate to other areas of your body. Prostate cancer, from what I was told and from what I've experienced, likes to spread to the bones specifically. And in my case, it spread to the hips and to the spine, and perhaps a little bit to my lung. I'm not sure. But it preferred bone rather than soft tissue, which is a good thing. Let's see what else. Metastatic. It is. I think that's it. This means it has metastatic. Means that it has spread to other parts of the body. Okay, and that has already been treated with other anti-cancer treatments. So that can't be the first line of attack. They have to have given you other medications to combat your prostate cancer. How does the medication work? It binds to a protein that is found on the surface of prostate cancer cells. Once bound, the radiation emitted from the nuclear protein causes the prostate cancer cells to die. Tests will be performed to see if the PSMA, which is the protein found on the surface of prostate cancer cells, is present on the surface of the cancer cells. Your cancer is likely to respond to treatment with the medication if the test result is positive, which is a little counterintuitive. If you don't have this kind of protein, the medication is less likely to be effective. So the worse your cancer, the way I understood it, the better the medication responded or acted. The use of the medication involves exposure to amounts of radioactivity. Your doctor and the nuclear medicine doctor have considered that the clinical benefit that you will obtain from this procedure with the radiopharmaceutical outweighs the risk due to radiation. If you have any questions about how the medication works or why this medication has been prescribed for you, ask your nuclear medicine doctor. And then they give you the ingredients, and then they tell you what you have to do. For example, you cannot use Pluvicto if you're allergic to something called lutetium, which is, I'm not going to read the whole thing, but it's an ingredient of the medication. To help avoid side effects and ensure proper use, talk to your healthcare professional before you take the medication. Talk about any health conditions or problems you might have, including if you have low level of blood cell counts, if you have or have had tiredness, weakness, pale skin, shortness of breath, bleeding or bruising, have or have had kidney problems, have or have had any other type of cancer or treatment for cancer, which they knew that I had, are under 18 years of age, which, as you can see, I am not under 18 years of age, are sexually active, blah, blah, blah. Okay, let's see. And then they give you some instructions about what you should do if you're going to use the medication. And they tell you, medication will be administered intravenously under the supervision of a health professional who is experienced in the use of radiopharmaceuticals. Let's see. Then they give you instructions about what to do because they make it very clear that you're going to be radioactive and therefore dangerous to other people immediately after getting treated with this medication. Specifically, pregnant women, but also other people. So they want you to stay away from other people for about 2 or 3 days. And away from other people means 2 to 3 feet. Although I got to tell you, I got the feeling that the people that were administering the medication were not completely familiar with how far you had to be from them. Some of them said 2 feet, other people said 3 feet. Let me see if this tells me something to refresh my memory. I don't know, it says within 2 days, over half of the radiation will leave your body. Within about 14 days, most of the radiation will be gone. It's about 99%. Ooh. Just to give you an idea, I guess, I don't know who would be flying from coast to coast, but it tells you after 1 dose of the medication, a care partner, someone who takes care of you, may be exposed to the same amount of radiation as 3 flights from the East Coast to the West Coast of the United States. I guess they're talking about people taking care of you, not you. To minimize your radiation exposure, drink plenty of water and urinate as often as possible during the first hours after administration. So that gives you an idea of the dangers of this particular drug. And it'll also give you an idea of how we were bringing out the heavy guns, since the lighter guns had not worked so well and they had stopped working. The good news was that the heavy guns seemed to be working pretty well. So that's definitely fortunate for me. Because to give you an idea, well, my PSA, which is my cancer indicator, had gone down to about, let me see, what do we have here? 8 nanogens per milliliter of blood. And I had started with about 100. So that's pretty good news, I think. Oh, and another thing that I wanted to tell you was that all those warnings of side effects that had been given here, let's see where this is. Tiredness, shortness of breath. All those precautions didn't show up as seriously as they had told me that they might show up. So I got a little bit of nausea in the mornings during the first week, but they gave me some pills that fought that, and they took care of the nausea pretty rapidly. So that was not a problem. And that's the end of this video. So if you have any questions, oh yeah, that's what I wanted to tell you. Please subscribe to this channel if you like it, and if it's helping you in any way. I'm trying to help people who have been or are in the same boat that I have been or am in. And so if you have any questions about things that I've gone through, please not only subscribe, but send me your questions and comments so that I can reply to them. Okay, so I'll hopefully see you soon. Hopefully tomorrow or the day after. Thanks.